Okay, hi everyone. It's Catherine Summerall with Real Estate with Catherine here at Keller Williams Realty, and I'm coming with you to you today on the conversation series. So a little bit about myself. I've been serving the Durango real estate community for the past 7 years, and that has included over 130 families served. And the reason why I developed this conversation series that we're going on like 8 weeks strong is because I felt this notion to provide a platform for leaders to step up in the community and provide perspective and information and just a conversation that we can all lean into as we navigate some of the interesting times that we're in with COVID. And so what that has offered us today is an opportunity to speak with Dr. Kelly Miller. So Kelly is an amazing physician and community leader that absolutely leads with her heart. And I'm getting like the warm and tinglies as I like say that out loud because it's just so true. And her compassion and commitment to our community is inspiring. And so when I'm thinking of people that I would love to construct a conversation about, I absolutely thought about her from the standpoint of healthcare. And so Kelly, would you just introduce yourself a little bit and tell us a little bit about you?
Sure. Thanks, Catherine. I'm really happy to be here. I have been a pediatrician here in Durango going on 18 years now. This has been where I've launched my pediatric career. I'm a mom of 4 kids, been married for over 22 years, and actually used to come to Durango every summer from age 5 through I graduated high school. So age 5 through 17, I came to visit Durango every summer with my family from Oklahoma to visit a dude ranch up Florida Road. Then I worked as a counselor at the dude ranch, Colorado Trails Ranch, for a couple of summers. And then as soon as I could get my pediatric training done and my doctorate degree, I was able to come back here and practice pediatrics ever since. So I'm lucky to be living the dream, doing what I love and loving what I do here.
Love that. I didn't even know some of that about you. Way cool.
Yeah.
So let's kind of just dive into some of the content I know that we'd like to share with everybody and talk about your practice that you work at now and kind of how, you guys have been doing telemedicine for some time, but certainly how is that becoming more of a priority as we navigate COVID?
Yes, so I am an owner and founder at Pediatric Partners of the Southwest, and we opened up clinic 15 years ago, July of 2005, currently now at the building along Horse Gulch, loving our views. We have been doing telemedicine, telehealth, it has different names, for about 5 to 6 years. It's just been in a different fashion. Previously, we had Children's Hospital coming to do virtual visits here at our office at Pediatric Partners. And we would have rooms set up sort of like this with a screen in the background, and the patients would come into an office room like this, and we would have our nurse and some equipment, things from a stethoscope to lights to obviously being able to weigh them and get some measurements and vital signs on them. And Children's Hospital specialists would pop on the screen and visit with the family. And we started with just a few different specialists, and we've expanded to almost 20 different specialists. Some specialists would come periodically in person, like a cardiologist, because they need to wave an ultrasound on a baby's heart and chest. And other specialists have been coming via the screen, like endocrinology, diabetes, genetics, and it's been expanded through the years, like I said, to almost 20 different ones. Then after that, we started using telemedicine like this, but putting us in the specialty role. So we set up a clinic in Silverton through the public health department and the school system, and then they could contact us in this virtual way, and we were helping to serve the pediatric population in Silverton. Then we started doing it for our patients who might live further or for things that might benefit themselves virtually, rashes, pink eye, allergies, some emotional behavioral health issues. And so we had equipment in the works, and we had some of our families enabled on telemedicine. And then as soon as COVID hit and it was a sudden stop in everything, we switched over to doing most of our visits telemedicine. We've been trying to keep newborns to age 2 face-to-face when they're well, so we can keep their development, growth, vaccines on schedule. But all of our sick visits, even non-sick visits, concussions, acne, everything we've been trying to do via telemedicine. And we have our patients and their families pretty well equipped. If they can't do video or apps that are confidential, we've been lucky that we're able to all branch into things like FaceTime, Yosemite. There's a couple different Zoom-like apps that we can do with families so that we're able to continue to see them and keep families, patients, our staff safe during this time that we're all going.
Right. So certainly, so there was a pivot there, but you had the infrastructure set in place already, and so you just kind of moved to that. Maybe for people, because we get a whole variety of community members looking in on this type of platform. And so, maybe telemedicine, maybe those have never done telemedicine before, and maybe that's a little intimidating, or, what would you say for people to, regarding doing it for the first time, or?
Well, we're lucky. We've got plenty of knowledgeable people in our office who will walk a family through it. So in many cases, when you're trying to send a link, it's confidential. Just like when you send a Zoom link, it's unique to that meeting. We have links that are unique to that patient, so it's confidential. And we will have people in our office, family advocates, get on the phone with a family and help them download it, walk it through. And again, if they're struggling, we'll pop on FaceTime or try other apps. Children's Hospital uses the same video equipment that we use, and they have now branched into 5,000 to 6,000 telemed visits a week. And I think so many families have loved it and love not traveling. And I think we've also gotten some insight into what are patients like in their home, and that's a beneficial observation too. And so I think even after this COVID era, or as we change things, I think many healthcare professionals and specialists will continue to use it for some of their visits or for people who are further away.
Yeah, that's awesome. One of the silver linings that are going to come out of some of the challenge, right? There's going to be new standards and opportunities that become more accepted. And so, as we start to transition through, we're maturing through this time of COVID, and that's meaning like less openings of businesses and such. And that is also relative to, openings of clinics. And you want to talk to maybe like best practices and even specifically what your clinic is doing as far as protocols in place.
Sure. And I'll give you guys, I actually listened in on a conference that Children's Hospital, they've been doing a town hall meeting once a week to trying to give good updates that's pediatric specific. I feel like we've got lots of great information coming from you, coming from San Juan Basin Health, that people can go get a good feel for what is it like in our community, what are our cases like. But really, what is it like in that pediatric realm? We don't always see because it is a smaller group. So I guess I will share from a pediatric standpoint what children shared last night, which is they have had 93 cases. So when we think about the entire Colorado, we're up to about 18,300 cases. From a Colorado standpoint, 944 deaths. If they look at the pediatric, anybody who has a child who's sick enough to be hospitalized, like that child would probably not stay here or stay in Cortez. That child would probably get transported to Children's Hospital so they could care for them at the best ability. And so Children's Hospital, what they've had to date is 93 positive cases. A little less than half of those have been hospitalized. So 42 inpatient, 51 outpatient. Needless to say, they don't have all the outpatient cases. They have them in that Front Range area. The majority of those who are testing positive are the sort of like we see in the flu, those who are very young, less than 1 year old, and those who are greater than 15. And they have had 9 in the ICU and 1 death. But just to give a little bit of just what is pediatrics, sort of in a snapshot for COVID in our state. Now thinking through, so is it a good time to open things back up? I think right now the only eyes that are on many kids are the eyes of their parents, right? They're not with their friends. They're not in school. They're not in daycare. So right now, the only eyes on kids are their parents, which are hopefully wonderful, supervising, loving eyes. But it's the same eyes every day. And so I think we're ready and worried and wanting to get kids back in to watch their growth and development, check in on their behavior, their emotional state, their mental health. And we have certainly been following state guidelines and what Children's Hospital does. So as we launch into this new look, we are looking at reopening our clinic not next week, but the week after, so May 18th, Monday, May 18th. And certainly we want to make sure that the child's health, the family's health, our staff health is of utmost priority as we open things back up. We are opening up to well kids. So any well check, we were doing kids newborn to 2. Now we're going to open up to well checks, newborns up to young adults or teenagers, as long as they are well. We will open up to sick visits as long as they are not sick with fever or respiratory symptoms or gastrointestinal vomiting diarrhea. They're coming in for acne, concussion, mild injury, emotional health follow-up, we will do that. So really wanting only well people to come into the office. We always have had separate waiting rooms, but we're trying not to use the waiting room at all. We basically will have families call from the parking lot, say we're ready, and then they will be escorted in directly to an exam room. We're so lucky we have a big office. Our main office has 22 exam rooms, and we'll have 3 providers, and so we can really spread out. We're going to take schedule patients longer visits so that they're not overlapping on their way in or out. We will require masks for kids age 2 and up. Hopefully they'll wear it. We know some kids may not, and it's not a fight we can fight. We're encouraging only 1 child at a time, not to bring the siblings if they're not being seen. Ideally 1 parent if able, so we just can allow more social distancing. So masks and good hand hygiene. As the staff, when the nurse and the doctor are seeing and the provider are seeing the patients, mask, good hand hygiene or gloves. And as we go to approach the patient, the child, we'll put on goggles or face masks as we get closer for their exam, or if we're doing any labs or vaccines, just as an added precaution too.
Okay, that's I'm just processing through. It's a lot, right? But we, just as we like had an adjustment phase at the very beginning, like we're going to have an adjustment phase to some of these new normals, and you know, that's just what I'm thinking through is the fact that we're going to get adjusted to what this looks like. And it's good to get an idea or start to get an expectation of, hey, when we do start to go into the office as on an as need basis, this is, you know, don't be frightened when I'm wearing my gloves and my mask and my thing, you know?
Mm-hmm. Yeah, I certainly, that's going to be a new thing for kids. It is daunting. It's really hard seeing the babies and you're talking to them and you're used to using all your facial expressions and they reciprocate that. And now I'm talking to them with the same, you know, joy and inflection that I normally do. And I'm not getting the same smiles back because they just can't see that under the layers. And we miss that. But safety is the important piece right now.
And so let's kind of review red flag illness, quote unquote, for kind of across the board. And I think a lot of that, if there is a differentiator between kind of the pediatric side and then an adult side, I don't know. You can maybe.
Right. I mean, I think the bottom line is any of the red flags you would have ever called right away to your primary care doc or run to the ER for, like, I have acute shortness of breath. Don't wait. You know, I'm throwing up blood. Don't wait. I have belly pain and I'm worried it's appendicitis. The things that we've always recommended you need urgent evaluation for, you still do that. And I think relying on the fact that your emergency department, your urgent care, your primary care offices have done systems and have systems in place to be safe for those situations. How are we isolating people who are concerned for COVID versus not? So know that we've now had enough time to work out those systems. And so if you normally would have gone to the emergency department or guided to do that because you had a first time seizure, please continue to do that. We don't want to halt any care for somebody. And then if you have a chronic illness and you're used to taking medicines for your asthma or for your diabetes as a child or an adult, continue to take all your normal medicines. You want your health to be at its best so that if you do get COVID virus, your baseline health is best. So continue to see your primary care doc or specialist for all of that. The COVID red flags continue to be if you are short of breath, if you are working hard to breathe, if you are altered in your mental status, you are extremely fatigued or weak, those would be reasons to go in urgently. If you are concerned you may have COVID and you have mild respiratory symptoms and a fever, but wouldn't otherwise need to be physically seen, then talk to your primary care doc. It used to be we had limitations in testing, and it's great to now say that we don't have limitations. So now they are recommending, the testing guidelines are to test every symptomatic person. So before it was just those, you were near somebody who was positive, you had higher symptoms, but now because we have full testing, they are recommending to test all symptomatic patients. So you should be able to call your primary care doc. You can also look on San Juan Basin Health lists all the places through Cedar Diagnostics in Pagosa, Cortez, and Durango. And Mercy also is doing testing as well as an urgent care. So anyone and everyone should be able to get testing now, both during symptoms with a PCR nasal swab that comes back within 24 to 48 hours. And then antibody testing is another piece. If you thought you had it weeks ago and you'd like to know, and we didn't have all the testing early enough, you can kind of catch up on that now with antibody testing. So that is great that now we can offer that in full to our community to really get a better sense of how we are doing. And as we start to liberalize and places open back up and still following masking and social distancing, you know, we can keep better track of what our rates and numbers do of positive cases.
Yeah. And kind of along the lines of that comparison, if you have any perspective for La Plata County versus some of our neighboring counties, or
yeah, and certainly for La Plata, I still feel like we're in a good little bubble here on our side of Colorado. I think the numbers, I did pull them off last night, and we're at 64 cases in La Plata County, no deaths. Neighboring in Archuleta, so Pagosa, 8 cases, no deaths. And in Montezuma, Cortez area, 21 cases and 2 deaths. So we're still staying relatively small on our side of the state line. And again, with more liberalized testing. But when you do cross the state line and go into New Mexico and the Farmington, Bloomfield area, San Juan County, they have over 10 times the rate that we do. Them off last night too. Yeah, San Juan County yesterday, 921 cases. So that's like 15 times the rate we have here, and 62 deaths. And certainly we have people coming back and forth. We have people who live in Durango who work there, even in the hospital community, or many jobs. And we have people who live in San Juan County who commute here for their job and essential workers. And so that is going back and forth. And so we certainly need to continue to follow our safer at home and social distancing and masking because we have a lot of hot spots very near us.
Mm-hmm. Yep, great perspective and information. Let's talk about this idea of immunity. And you talked a little bit earlier about baseline health and what's some things that we can do for adults and children, and just let's maybe have a little bit of dialogue around that.
Yeah, the best thing we can do is stay well, and if you're sick, stay at home. Isolate or quarantine, depending on, are you sick or were you exposed to someone who is positive. Eating healthy, getting good rest, getting your exercise. We're grateful to live where we live so we can get regular exercise. There's different recommendations out there on vitamin D, vitamin C to help support your immune system as well. And as a pediatrician and healthcare worker, I will always promote staying up to date on your vaccines. I think we're starting to see, as people might be going to their primary care doc or healthcare provider less, some of those vaccines rates are starting to decline. In Colorado, we tend to have a lower vaccination rate as well. Our schools do not require vaccines. It's a personal you can sign out for a personal preference. And so we do have a lower rate. And I would certainly worry if some of those rates go lower, because we have seen outbreaks of measles and mumps in different areas in the Midwest, California, et cetera. And as we start to kind of think through COVID and immunity, what do we need to sort of make it go away or decrease the spread? And so you'll see some things on news stations about immunity. Herd immunity is something they throw out there a lot. And herd immunity is such, if you had a group of 10 people and you wanted to put someone in the middle to protect them, right? You might put great-great-grandma because she's 90 some years old, or you might take tiny little baby who's too young to have vaccines, or you might take the neighbor next door who has cancer and is on chemotherapy, and you put them inside your herd of 10 people because you want to protect that person from getting anything. And you hope that 7 or 9 of the people in that circle all have immunity, and you protect that one who maybe can't get a vaccine or can't get the illness. So how do we build that immunity up? You want to get exposed to something to build up immunity, but most of us don't really want to get exposed to COVID. And so really what they're looking at is probably 70% of a population needs to have immunity to COVID to protect the whole. So right now, we certainly don't have 70% of the population who would test positive to COVID. And if we did, we would have overwhelmed our healthcare system. And probably in some places, maybe we have 5%, maybe some places 10, New York, maybe they're higher up there at that 15, but obviously not 70% for natural immunity, acquiring the virus itself. So at some point, we're really going to need to lean on vaccine immunity to help build up the remaining to get us up to 70%. And it will come. There's certainly lots of different places working hard to get it. And then who will get it first? Is that going to be the older population, healthcare workers, younger kids? We will have to see, but we certainly are going to have to lean on vaccine immunity plus a small percent of natural immunity to try to get us up to that 70% number to help this go away.
Oh, interesting. Well, as we kind of wrap up, I know we've talked about a lot. It's really a great conversation. What would you maybe leave people with, or if you using this as a way to just share what you're seeing in your world on a day-to-day, and what would you leave people with?
Yeah, I know we all want to get out, and we're grateful where we live to get out. I know we want to be social, but again, remember what is just a few miles away when we cross state lines. So continue to practice that social distancing and mask. Really take the mentality of when you're putting on your mask, you're not putting on that mask like so that I'm protecting me. This is not a selfish task. We are putting on our mask to be selfless. We are trying to think of others so that, okay, I have some allergies and I sneeze. Uh-oh, what if really I was the day before getting COVID and I sneezed on the cereal box at the grocery store and then someone else came and picked it up? Certainly we can spread this pre-symptomatically, asymptomatically a day or a few days before we're positive. And so putting on that mask is a selfless task to protect people around us. And I love to exercise. I love to be outdoors. So you will probably see me not wearing my mask if I'm on trails running. But if I'm getting close to you, I'm going to pull out my mask and I'm going to put it on so that I can say hi and visit with you. So really take that mentality of I'm doing this to help others. That's the Miller motto every day. What did you do to help others? So we can make a difference.
Yeah. Well, I'm just so grateful for you. My family's so grateful for you, and as a just someone that's really leading a charge in our community and on the front lines, and working with people both at the hospital and at PBSW. Thank you. You're awesome. Truly mean
Thank you,
that.
Catherine. I
And
enjoy you and your family.
hopefully we'll see you
I
soon
know.
when
See
that
you
all works.
soon.
Yeah.
Yeah, with our masks on for sure. Thank you for doing this.
But if people have questions, where can they find you? What can they leave our conversation with that?
Yeah, and so people are certainly always welcome. If they've got medical questions, call our clinic. We have a nurse available all day long, even after hours. We have a nurse. We certainly want to be available by phone to answer questions 24/7, so we can help triage. Do you need to go to the emergency room or urgent care, or can you wait, or can we get on a televisit and help you right now? So call our office at Pediatric Partners 375-0100 anytime. And we try to keep things up to date on our portal, our website as well, and portal, so that people can find useful information and lean on this on the health department. San Juan Basin Health has had a great information online too.
Good. Awesome. Well, I know you got to get going. Thanks for your time today and loved it. And have an awesome Friday and a great weekend.
Thank you. You too, Catherine.
Okay. Bye.